Should you get the new Pfizer RSV vaccine? What's going on, everybody? My name is Golfran Alejandro Rivera. I'm a board-certified physician assistant. I practice family medicine here in the state of North Carolina. If you or someone you know and love is pregnant and considering the new RSV vaccine, you're going to want to watch this video because in this video, I'm going to address 3 important questions that I believe every single patient should know the answer to for any vaccine before they give informed consent. Now, I posted a video a few weeks ago explaining that I am neither for nor against the use of vaccinations. And I want to explain that a little bit more in this video. If you're in a hurry and you just want to know the answer to the 3 questions that I'm going to answer in this video, you can go ahead and skip ahead. I've put the timestamps in the description below. But before I get into that, I did want to explain, what do I mean when I say I, as a medical practitioner, am neither for nor am I against the use of vaccinations? I am all about informed consent. Here's the thing. Vaccines have always been controversial. Ever since the first inoculation back in 1796, when a small boy was inoculated with smallpox, vaccines or the idea of immunizations and vaccinations have been controversial. There have always been people who were either resistant or outright opposed to the practice of vaccinations, right? And it definitely feels like over the last few years, the sense of even disdain against vaccines or the use of vaccines has grown, and the doubt surrounding them it feels as if it has grown. And I think one of the things that makes this situation a little bit more complicated is that now we have, medical influencers online espousing all kinds of things on either side of the discussion, people with all kinds of qualifications within the medical profession that are saying why you absolutely should not get a vaccination or why you absolutely should and must get a vaccination, espousing all kinds of controversies and conspiracies. And I want to stay out of all that. Okay, that does not interest me. What I really want for my patients and for those of you who are watching, what I hope brings value to you, is I want to give you 3 relevant questions, practical questions that I think no matter where you land on the spectrum of this discussion, the answer to these questions are ones that I think are reasonable for every patient who's considering vaccinations of any kind to know the answer to, if they're going to give their informed consent. The first question is, how common is the infection that we're trying to prevent? And what's the absolute risk that me or my loved ones are going to be dealing with this infection? Number 2, what is the absolute risk reduction with the vaccination versus placebo? And number 3, what is the number needed to vaccinate and what is the number needed to harm? In other words, about how many people need to receive a vaccine before one person potentially receives the benefit, the protection that the vaccine is trying to offer, and how many people need to receive the vaccine before somebody could potentially be harmed as a possible cause of the vaccine itself. To answer these questions, I'm going to focus on Pfizer's new RSV vaccine that was recently approved by the FDA back in August of 2023 for pregnant mothers who are about 32 to 36 weeks in their pregnancy in order to prevent RSV infection or reduce the risk of severe RSV infection in the first 180 days. So, how common is RSV infection? And what's the absolute risk that you or your loved one, and specifically the little ones, are going to be dealing with an RSV infection, and one that's severe, right? That's what we really want to know. Now, to answer this question, I looked at 6 different studies, including the Pfizer study. I've cited all of them in the description below, and I've also, for those of you who like to read, I put a link in the description for the blog post that I wrote detailing each one of these little things. So here I'm going to summarize them for you, okay? Now, I want to say up front that an important thing about RSV, or the discussion about how common RSV is, we have to acknowledge that around the globe, the RSV disease burden is quite substantial. Okay, and in low and middle income countries, it is the leading cause of death in many children throughout the world. But my patients are in the United States, and this video is for people within the United States. And so the question really is, how common is an RSV infection for children in the United States who are younger than 12 months of age? That's what I'm going to be answering right now. We can break out that answer into really three components and a fourth one at the end. The first three components are how common, or what's the risk that an RSV infection in a child younger than 12 months of age in the United States will result in a visit to a clinic where the child will be examined and then sent home to recover with mom and dad. That's number one. Number two, how common is it that RSV warrants a trip to the emergency room or the emergency department? How often does that happen, right? And then number three, how often is it the case, or how common is it the case, that an RSV infection is such that a child needs to be hospitalized for treatment? And then the fourth one, the last one I'm going to talk about, which I think is very relevant, is how deadly is RSV in the United States for our little ones that are younger than 12 months of age. So for the first category, which is outpatient visits, where a child goes in to be seen and then gets sent home to recover, using the 6 studies that I looked at. And by the way, one of those was a systematic review that actually included 25 different studies. So these ranges include those results. The range for that was 2.34 to 2.8%. What that means is that between 2 and 3 children younger than 12 months of old in the United States, out of 100 children, potentially will have an RSV infection that results in a visit to the outpatient clinic and then recover home, right? 2 to 3 out of 100, okay? Looking at the second category of emergency department visits, the range that I found was 0.025 to 4.74%. So it can be as little as none to as much as up to 5 kids out of 100 that have an RSV infection that ends up in the ER for treatment. Now, once they're in the ER, they may or may not go on to be hospitalized, or they may get to be sent home after some observation. The studies don't really break that out. And right now you might be wondering why such a big range. I'll talk about that in just a second. But for now, remember, emergency department visits for RSV in children younger than 12 months of age in the United States, 0.025 to 4.74%. And the last category here is hospitalizations. How often do little ones end up in the hospital because of an RSV infection? For this one, the range was 0.252 to 2.37. From 0.252% over to 2.37%. Again, less than 1 to 3, about 3 children will have an RSV infection that results in hospitalization. Now, why these ranges? Why does this information, why does it look like there's a big difference? Well, frankly, whenever we're looking at RSV cases, the kind of study that's being done, how they define a true RSV case will vary. In addition, different sources of information, different populations within the United States are being looked at when these calculations are being made. No trickery or nothing like that. It's the nature of medical research. So that's why sometimes the ranges can seem a little big or a little small, depending on what the data sources are. And again, this is based on what I found when I conducted my search in these 6 studies. But there's a fourth important question in regards to how common RSV is. The question is, how common is it that little ones in the United States actually pass away as a result of RSV infection? Now, for this one, I was only able to find one study that answered the specific question of children in the United States younger than 12 months of age. But I like this study because they actually included 20 years of data. They went from 1999 all the way to 2018. So they included the year 1999 in that, right? 20 years. And here's what they found. In the 20 years of data that they looked at, there was 561 confirmed deaths as a result of an RSV infection. 561 over 20 years. So that calculates out to 28 deaths a year on average, right? Plus or minus, for the span of those 20 years. And the authors use this to calculate a mortality rate of 0.00069%. That means that 6.9 children out of every million that are born would pass away as a result of the RSV infection. This means that by definition, RSV is deadly. But is it incredibly deadly, or is it a death sentence? Well, I honestly believe that parents should be the ones to decide whether or not that's a high enough mortality rate for them, or if that's a risk that they want to take. Question number 2 that I want to address in this video is, what is the absolute risk reduction from using the vaccine compared to placebo? Now, it's important that we focus on absolute risk. Why? Because relative risk, which is usually used to compare the benefits of one intervention versus another, while it can be mathematically accurate, it can sometimes be a little bit misleading. For example, using made-up numbers, if let's just say that the absolute risk reduction of something is 1%, but compared when we use relative risk, we might actually be able to report factually that the relative risk reduction is 50%, meaning that you have a 50% less chance of having this thing if you use this intervention. And you can honestly report that without any tomfoolery when you use relative risk. But of course, that's a little misleading because sure, there's a 50% less chance, but what was the chance before, right? So absolute risk reduction gives us a little bit of a more accurate sense of what our risk is and what it now will be. Now, for the Pfizer vaccine, for the Pfizer RSV vaccine, I looked specifically at the studies, looked at how many people received the vaccine, how many mothers received placebo, how many cases of RSV took place, and then they broke it out as well in terms of just cases overall and then severe cases. So I'm going to tell you what the absolute risk reduction is for both. Absolute risk reduction for RSV infection and then absolute risk reduction for severe RSV infection. So the placebo group had 3,676 mothers. The vaccine group had 3,682 mothers that received the vaccine. The investigators of the study reported that in the first 180 days of life, there was 117 cases of RSV infection, just RSV infection overall, in the children that were from moms, born to the moms of the placebo group. 117 cases in the first 180 days. When you do the math, this makes the absolute risk for the placebo group of an RSV infection 3.19%. 3.19%. In contrast, there was 57 cases of RSV infection from infants that were born to the mothers in the vaccine group. That makes their absolute risk 1.55%. So how do we then get the absolute risk reduction? Well, we actually just take the absolute risk of the placebo and subtract the absolute risk of the vaccine group, and that gives us an absolute risk reduction of 1.64%. What that means is the vaccine, compared to placebo, drops our risk down by 1.64%. It takes our little one's risk down from 3.19% to 1.55%. Now, what about severe infections? Again, same group of mothers for the placebo group and the vaccine group. In the first 180 days, the investigators reported 62 severe RSV infections. That gives us an absolute risk of 1.68%. Meaning, in the first 180 days, there is a 1.68% chance that little one will experience a severe RSV infection. That's in comparison to 19 cases of severe RSV infection for infants in the first 180 days of life who were born to the vaccine group, which makes it an absolute risk of 0.516%. So when we compare the absolute risk with the placebo group to the vaccine group, the absolute risk reduction, meaning the vaccine drops the absolute risk of a severe RSV infection for little ones from 1.68% down to 0.516%. Therefore, the absolute risk reduction is 1.164%. The vaccine reduces our risk by 1.164%. Is that a lot? Is that a little? Is it worth it? I think that's up to you. I think that's up for the parents to decide, right? Now, something that puts this in perspective that we try to use to help us understand or help us decide whether or not something is kind of worth it or not is what is the third question, which is what is the number needed to harm and what is the number needed to vaccinate? Again, the number needed to harm is an estimation of how many times a treatment needs to be given before there's a possibility that someone could potentially be hurt by the treatment itself, okay? Again, these are statistical analysis. It's not a hard and fast rule, but it's something we use to kind of gauge whether or not something is worth it. And to be clear, there's no value that is automatically safe or unsafe. There's no value that is immediately dangerous. These are relative terms that we use, and you'll see what I mean in just a second. For the RSV vaccine, using the data that's been provided, and again, if you're curious about the breakout of all these things, the information is in the description. But using the data that's provided in the supplementary appendix of the Pfizer study, we can actually calculate the number needed to harm for two separate categories. The investigators reported how many adverse events took place in the first month of life, as well as how many serious adverse events took place in the first 24 months of life. So any adverse event in the first month of life and serious adverse events in the course of 24 months of life, right? And they reported values for both vaccine group and the placebo. And using those values, we can come up with a number needed to harm for each. The number needed to harm in the first month of life is 43.73. That means that if we gave about 43 to 44 mothers the vaccine, there is a possibility that after the 44th vaccination, one of the infants may experience an adverse event that could potentially be attributed to the vaccine. As far as serious adverse events in the first two years of life, 24 months, the number needed to harm is 149.65. 149.65. Again, that means that if we gave approximately 150 vaccines to the pregnant mothers, there is a chance that after the 150th vaccination, one infant may experience a serious adverse event that could be attributed to the vaccine itself. Could be, could not. Now, let's compare that to the number needed to vaccinate. Remember that the investigators reported on both regular RSV infection that required medical attention and severe RSV infection. So we'll come up with a number needed to vaccinate for both. The number needed to vaccinate to prevent any RSV infection in the first 180 days of life is 61.17. That means that we would need to give about 61 to 62 vaccines to pregnant mothers before there's a possibility that an infant would gain the benefit of avoiding an RSV infection. And then the number needed to vaccinate to prevent a severe infection is 85.43. So about 85 to 86 mothers would need to receive the vaccine before there's a possibility of benefit and protecting an infant from a severe RSV infection based on the data that was provided. So the number needed to harm in the first month of life, again, is 43.73. The number needed to vaccinate to prevent any RSV infection is 61.17. So by the time that we have given the 61 vaccines, we've already exposed one child to a potential adverse event in the first month of life. Now, in contrast, for a serious adverse event in the first 24 months of life, so in the first two years of life, remember that's 150, right? So we would need to give about two vaccines, a third vaccine, before a child would potentially get harmed, have a serious event attributed to the vaccine. And I hope that makes sense. If you have any questions, you're more than welcome to comment below your questions, and I'd happily respond to you. Again, with all this being shared, what does it mean? Should I get the vaccine? Should I not? It's really up to you. I personally think it's up to you. Now you have the information for you to make an informed decision. And if you still have questions, if you still have doubts, if you're not sure if what I'm even saying is true, bring this up to your medical practitioner. I believe you're entitled. If anything else, just go with the 3 questions. How common is this, and what is the absolute risk, right? What is the absolute risk reduction of the vaccine compared to placebo? And lastly, what is the number needed to vaccinate and the number needed to harm? I believe all patients are entitled to the answers to these questions prior to giving their informed consent. Thank you guys so much for taking the time to watch this. If you know anybody who has questions about this vaccine and you think this video would benefit them, please do me a favor and share it. And please make sure you like and subscribe to this video, as it helps me get the content out. Now, if you happen to be in the Fayetteville, Hope Mills area and you're looking for a family medicine practitioner, hit me up. The information to contact me is below. God bless you guys, and thank you so much for watching.